My name is Dr. Motolani Ogunsanya. I'm an assistant professor of pharmacy at the University of Oklahoma Health Sciences Center. I'm also a faculty at the TSET Health Promotion and Research Center at the Stevenson Cancer Center of the University of Oklahoma. I do research in prostate cancer, especially in Black men. I have a vested interest in improving quality of life outcomes in ethnically diverse Black males. So what does that mean? I look at not just Blackness as a monolithic concept. I like to see their country of origin, their culture, because we know all these factors, in addition to social determinants of health, will play a huge role in their overall survival and even outcomes when it comes to prostate cancer. The study was funded by the Department of Defense through the Early Investigators Research Award, and we did interviews with 30 men. So the research methodology was using qualitative grounded theory. So what does that mean? We want to know the lived experiences of these men. What are some unique factors that contribute towards their overall survivorship when it comes to prostate cancer? So we enrolled 30 men. The enrollment began in 2021, and 50% of those men were native born, meaning those were born in the US. We had 9 men who came from Africa, and then the remaining 6 were from Caribbean countries. Now, of course, what we also wanted to look at were the similarities, but also the differences when it came to the experiences, because we know that Blackness is not a monolithic concept, like I said earlier on. By knowing just what are the unique contributions to how they even interact with the healthcare sectors, or even how their quality of life is being shaped, we're able to develop tailored interventions, because we want to make sure we're being considerate from a cultural standpoint. So 30 men were enrolled, and the average age was about 64, 65 years. Well, there's some similarities in the sense that, the diagnosis itself caused a lot of fear, which we already know that. And even having to navigate this unknown terrain now that they've been diagnosed with cancer. And many men took this news differently. While some men, so particularly for the African group, which I think is probably going to be more relevant to the audiences, they were less likely to communicate with their spouses about, one, the diagnosis, and also even the decision making. Whereas the native born men, the American born men, were more likely to involve their spouses when it came to the diagnosis, and also with the decision making when it came to therapy. The African men, even if they involved their spouse, it was more of a need to know basis, like, by the way, this is what we're going to be doing. Not like, what do you think of this? So I think that also highlights the importance of, communication. Overall, in the Black community, we see that there's limited communication when it comes to communicating our perceived susceptibility of diseases like cancer. So the findings from here would really highlight the importance of being open with our family members, because cancer is not just a disease that affects the individual, it ravages the family. So definitely how we can equip men to open up more with their spouses and also provide support along that line. Another big difference we saw that even though the average age was 64, if we were to look at the within group differences, the African-born men were diagnosed at a younger age compared to the native-born men, and they also tended to present with more aggressive forms. Although the Caribbean men had the most aggressive forms of cancer, but comparing the African men to the native-born men, and by native I mean the American-born men, they were diagnosed a little bit earlier, about 55 years. So that's like 10 years than the average, age of diagnosis. And we do know that cancers have been, especially prostate cancer in men, they have been diagnosed at younger. Even here in Nigeria, we're seeing, early stages of diagnosis, and even though the age of diagnosis have gotten younger, we're seeing more aggressive forms at both stage and grade of presentation. And I think that has a lot to do with just, the healthcare system here in Nigeria, and also how diagnosis of prostate cancer is actually done very late. And so I think the key here is just early detection, because cancers like prostate cancer, they have better odds of survivorship when you diagnose them early. The overall 5-year survival rate for prostate cancer is 99%, which is 95 to 99%, which, is very, very, is a good odds, if I would say. Another thing I would like to highlight is that there are 3 main risk factors when it comes to prostate cancer, and unfortunately, these 3 factors are not modifiable. So we call them modifiable, the ones we can change, and non-modifiables, the one we cannot change. Now, there are three main risk factors of prostate cancer, and as I'll tell them, you will notice that they are not modifiable. So age is one. And then the second one is your race. The last risk factor is the family history. So the message here is that, for us to help ourselves, we need to know. And early diagnosis is key. And also communicating the risk. So for men who have been diagnosed with prostate cancer, please talk to your family about it, because your first degree relative, like your children, might be at higher risk. We're even seeing some cross susceptibility, in the sense that, well, if the BRCA gene is present in the family, if the father has prostate cancer, chances are his daughter could also have breast cancer. So don't exclude your daughter in this narrative. Make sure you're carrying the family along, because the earlier you know, the better they ought to be. So overall, even though prostate cancer affects Black men disproportionately, we're seeing some unique contributions that race and ethnicity, ethnicity and country of origin will play a role. Now, another thing I forgot to highlight was the importance of communication with the healthcare provider. When it comes to just what are the take-home messages for the Nigerian group, I think first key is just early detection. I do acknowledge that in this part of the world, the healthcare model is out of pocket, meaning there's a lot of pressure on the individual to pay money for everything. A lot is not subsidized by the government. So as I'm talking about early detection, I hope the government can also match that up with providing affordable treatment options, because cancer ravages, it's very expensive, because some of this treatment can cost you as high as $50,000 to $100,000 per month, 100,000 naira per month. And what is the minimum wage, right? So but early detection is key. So one thing I would advise is, if there's a family history, start getting tested at the age of 40. And there are two simple tests, and I use that word very carefully. The first test is the prostate specific antigen, which is called PSA. It's a blood test. They just look at the protein levels, and it's age specific. So for your age group, you should have this level. If your numbers are deranged, then they might have to investigate further. Now, the thing with PSA, even though it's called prostate specific antigen, it's not quite specific. It's a biomarker that is not very specific for prostate cancer. You could have high PSA levels for a number of reasons. If you've just had sex and ejaculated, if you ride your bike a lot, if you have an infection, or you have a BPH, what they call benign hyperplasia. So it's warrant further investigation, which brings me to the second most commonly used test, which is the DRE, the digital rectal examination, which I'm sure many men are very familiar with. This is where they have to go in through your rectum to feel for your prostate. Now, depending on how it feels, it's supposed to be squishy and being like, if it's odd looking or odd feeling, the doctor might require you to do a biopsy where they just nick a little bit of it, put it under the microscope to see if there are any cancer growing cells. Now, that is that test that precludes a lot of men from getting screened, because it's been associated with being uncomfortable. In some Black communities, they equate that with homosexuality. But I would say, acknowledging the difficulty with that, life is, bigger than that. So talking to your doctor about what your options might be, but at the very least, if there's a family history, start getting screened by 40. And please go for your health check every year. Save some money and get everything done. Not just even your PSA, get your blood drawn, know your vitamin D levels, which is very, very important, because lower vitamin D levels have been linked to poorer, not like it causes prostate cancer, but we're seeing those numbers in those who have been diagnosed with aggressive forms of prostate cancer. And even though we're Black, but our melanin also precludes the absorption of vitamin D. And because we don't tend to stay outside in the sun anymore, we all want to stay indoors. For example, I'm indoors right now. We want to stay in cars with AC. We're not getting those vitamin D levels. Even our diets haven't been very enriched with vitamin D levels. So please run your numbers and go that every year, and know your own records. Have a file where you're looking at your numbers and talking to your doctor. If you can have someone plot a graph of just your numbers and your values, because if something is shooting up, there's timely intervention. So all in all, early detection, and also the government backing that up with affordable treatment, affordable options for people, so that way we have a healthy workforce. That would be my recommendation. The average age of men in the study were about 65 years, and with the standard deviation of 8. So they were, would say, 57 to like 73, if my math is correct on that. But the African group were diagnosed about 10 years younger. So we're looking at age of diagnosis at, 55. So again, they were diagnosed younger. Now, when it came to treatment options, we have several different options for prostate cancer, and the doctor will have to, whoever does the referral, it could be an oncologist or a radiologist, whatever you're saying, will determine the next best of course of action for you. But I want to highlight some typical treatments. We have radiology, which uses radioactive rays to kill the cancer. We also have hormonal therapy, where they use hormonal therapy to help with that. We have chemotherapy as well. And then there's something they call active surveillance, which is where the former name for that was watchful waiting, where they kind of wait, because some cancers are indolent, meaning that they're not quite aggressive. They just watch and see if it's going to develop into something troublesome later. Now, for men in the study, radiotherapy was the most common form of therapy, but we also had about 20% of men having double therapy. So perhaps they started with radiotherapy and they ended up doing chemotherapy. So you had men that had one or two forms of therapy. We also had about 2 men in the study that had triple therapy. They started with maybe chemotherapy, then they did hormonal therapy, and radiotherapy. Oh, I forgot to mention another form of treatment, which is radical prostatectomy. This is where the prostate is taken out, and usually you do that in stages, early stages. Now, whenever you diagnose with prostate cancer, they will have ways to measure or even see how far along the cancer is. So they have tumor grading, they have the Gleason score, they have is this what staging it is. Now, for the early stages like stage 1 and 2, they might recommend surgery. But when the cancer has spread, meaning it's no longer localized in the prostate, it's spreading to other areas like the lymph nodes, they might have to take aggressive forms. This is why, again, early detection is very, very important, because a lot of this therapy comes with side effects. Now, radiotherapy was one of the most commonly used therapy within the men in our study. It causes a lot of damage to the urethra, meaning where they pee from, and also to the penis as well. So you're having men with sexual dysfunction, which bothers them a lot, because masculinity, and the ability to express themselves sexually, these are things that are very important to men. And not being able to satisfy their spouses, it puts a lot of guilt on them. So imagine someone who's just survived cancer having to go through that. So we had a lot of mental issues, like emotional, because we had a measure for quality of life, and emotional domains, which measured anxiety, depression, sadness, and all that, they were quite low in our men. So again, another take-home point is the importance of mental health referrals at the point of diagnosis. Once a man has come into your clinic and he's been diagnosed with prostate cancer, please, let's see how we can refer them for mental health services, not just for them, but also for the family, so they can feel supported, and ask questions about the pros and the cons. What if I went for this versus that? What are my survival rates? What am I to expect as far as long-term complications? Now, finally, would be recurrence. Now, there's always a fear of recurrence. As a matter of fact, one of the biggest risk factors of having cancer, again, is having had cancer, right? So there's always that fear of recurrence. But there's some things, and this was some of the things we explored in the study, but there's some things that men tend to do as a way to kind of gain control. Religiosity and spirituality, being connected to a higher power. So you found men talking about their faith and how that helped them cope, knowing that whatever happens, their hands in their like life is in the hands of a higher power. Also, eating better. And then when you've had cancer, there's a second layer of acculturation that comes with that. So I find that the foreign-born groups, like the African and Caribbean groups, having to modify their diet. As you know, a lot of our diets aren't very high in fiber and high in nutrients like vegetables and vitamin D and lycopenes and those things that are good for you, or that rich in antioxidants. So they had to supplement their diet heavily, and this is where their spouses also play a huge role. This is why it's very important to open up to your spouse and let them know just what you need, so that way they can help you build you up. Another thing is also they tend to take their health more seriously when they've been diagnosed. They go for their screening. You find men that never used to go to the doctor's office, all of a sudden, because of the diagnosis, and they've been treated for cancer, they have to go ever often, sometimes every 6 months, to check for that PSA, again, that biomarker, to see the levels, because they want to keep it at a level that is manageable. If the numbers start shooting up again, that could be that the cancer is back, and then they'll have to go in for a second round of treatment. So, unfortunately, when it comes to science for prostate cancer, it's not quite direct, right? And we talked about how men are even less likely to have their yearly physicals done. But I'll just highlight some. Usually when you start having signs and symptoms, is often telling you that the cancer may have progressed, a little bit away from the early stages. But I'll highlight some example. One is blood in urine, right? One is urinary pain, like you're maybe even incontinence, you're going more often. Or when you go, you have the urge, but nothing is coming out. You can also have pain in your back or in your, pudendal area. And the last one would be erectile dysfunction. Now, some men might have one or none or even all of this. So usually when the signs start showing, it's not a good sign. This is why, again, prevention is better than cure, especially in this part of the world where the healthcare system isn't well equipped to handle the burden of cancers we're seeing, especially in our younger demographic. This is why you need to take charge of your health. Health should be on your priority list. The way you allocate budget for feeding, for putting a roof over your head, for your children's school fees, save some money and just go for your yearly checkup. Now, when it comes to diagnosis, in Nigeria, prostate cancer is largely undiagnosed. And this is because of so many factors. One chief one is that we don't have enough pathologists. From what I remember reading last, we have had about 106 pathologists in the whole of the country for over 200 and something million people. That's abysmally low. And I'm even thinking as I'm having this conversation, maybe one of them has even located abroad. So that number has probably gone down. And so what does that mean? Many people have died without, and their death might have been attributed to other causes instead of prostate cancer. And maybe something else we have, it could have been prostate cancer, but because we rely on autopsy cases to determine rather than using incidence. Now, incidence rate is an epidemiology term. It just means new cases. In the US, for example, we have databases where the country has been divided into regions, and then they report when someone has been diagnosed with prostate cancer, they have active reporting statistics where you put the data in a central repository. So if I wanted to, the SEER database, which is the surveillance epidemiology and results, which is the SEER database, is a database where if I wanted to know what is the incidence, what are the new cases in Alabama, for example, I can go in there and pull that data. We don't have that centralized data because we rely on after the men have died, right? And a lot of the systems I know, for example, Abuja has one, Ibadan has one, but they don't communicate with each other. And there's no centralized database. We don't even know the numbers. And because a lot of this gets also covered under what I call hyper-religiosity. You know you've been diagnosed with cancer, but then you just go away and go to a prayer house. There's nothing wrong with prayers, but making sure that you're doing it in a very judicious manner to save your life. So again, there's so many factors. And then the healthcare budget. Nigeria spends an abysmal low level of its GDP on health. The Abuja Declaration, which was done in, I think, 1994, 2004, this is when African governments came together. They promised to budget about 15% of their GDP on healthcare. The current GDP spent on healthcare in Nigeria is 4.5%. That is very low because the WHO actually recommends at least 10%. So we're not spending enough. We don't have enough physicians to even diagnose, pathologists to diagnose cancer. And our healthcare isn't even strong enough to cater for the volume of cancer that are coming our way. We're seeing younger people, especially our men, having prostate cancer, right? So definitely making our systems robust enough to handle these cases and training more doctors, making the conditions workable enough for them to stay. So that way brain drain is reduced, we're able to retain our talents because there's a wave coming and we should be equipped enough to deal with it. Cancer is becoming a huge burden in Nigeria. And again, because we don't have a nationwide registry to be able to know what the correct incidence rates, like the prevalence and incidence rates are, we rely on statistics from foreign entities like Globocan or IARC, which, they can be quite reliable, but then how reliable are they if we don't even have those, in-house? But we're definitely seeing a high rate of cancers, especially breast, in our women. And these are usually aggressive forms. I know personally two people in my circle under 40s who have had to have mastectomy, like removal of their breast. And sometimes they come up with aggressive forms like triple negative, which means that it's not receptive to cheaper therapies like estrogen or progesterone. So they've had to spend so much money on PET scans, and we've had to do raise fundraising because again, there's no way they can afford that otherwise. So we're seeing that a lot. And I think there's so many factors to that. Definitely environmental pollutants, right? That we don't have proper zoning laws in this part of the world, and even the food we're exposed to, we've left. Usually, you want to make sure you're eating food closer to the ground. Our food have become more refined. So many things are imported here that haven't been well vetted, and then use of pesticides haven't been well regulated. So make sure that if you live in a country like this where there's still a lot of work to be done on boosting the healthcare system, unfortunately, the buck is passed on to you. So you have to be very aggressive about your health. Be careful what you put in your mouth. Read the labels. Is it going to be good for you? We're also seeing kidney cancers, and I think that comes largely from the use of alternative medicine. There's nothing, I'm a pharmacist, trained pharmacist, so I believe in the power of natural herbs. But make sure you're asking questions about because some of them have very high levels of alcohol and even paracetamol in there that can be quite damaging to your kidney and liver alike. So make sure you're asking questions. What are the ingredients in there? Can I see the labels? Because some things might not be compatible. You can have the same medications because of just the way my body is set up, but might react differently to it. So again, prevention is cheaper than cure. So taking charge of your health will be, one of my biggest recommendations.
Investigations, special reports, analysis, and breaking news. Premium Times, a leading multimedia news platform, brings to you every minute stories that helps you make informed decisions and hold public officials, individuals, and organizations accountable. We have cartoons, videos, podcasts, and other interesting content for your delight. For timely update on politics, entertainment, sport, and business, visit our website on www.premiumtimesng.com and follow us on all our social media platforms. Don't miss out.